Hi, I'm Kristyn Hodgden, IVF mom, proud women's health advocate, and co-founder of Rescripted.
And I'm Dr. Jenna Kahn, a board-certified OBGYN, fertility specialist, and mom of two.
And from first period to last period, we're diving into the women's health topics that matter most, from periods and fertility to pregnancy and menopause.
Through expert interviews and candid conversations, we're empowering women to take charge of their health by expanding the discussion beyond what's typically covered in the doctor's office.
It's time to stop guessing when it comes to our health. Now let's dive in for the real science-backed info you need to be the expert in you. Hi everyone, and welcome back to From First Period to Last Period. I'm Kristyn, and hi Jenna.
Hi everyone, Dr. Jenna Kahn here, resident fertility specialist.
Welcome back. We're really excited about this episode. Got lots of fun topics to explore. First, I wanted to briefly talk about something that's been like trending on our site, and that is egg freezing parties and nesting parties. So wanted to mention this because I feel like when you're going through infertility, it could feel like all you see every day on your social media feed is pregnancy announcements, or maybe you're the single friend in the group, and you're not anywhere near having kids, but everyone else is having babies, and it's like, but every moment deserves to be celebrated, and every milestone, like getting a new job, freezing your eggs and preserving your fertility. So apparently egg freezing parties are on the rise, where girlfriends sort of get together and, celebrate a friend who is, freezing embryos for future use. And it's like the best idea for a celebration, because
I love that.
Like, what's more empowering than that?
For sure. Getting all your girlfriends together. I love any opportunity to have a celebration in my book is great. But I mean, what a great one for an egg freezing party. I just love that. I think that's such a great way to support a friend.
Yeah, absolutely. And then the other one is nesting parties, where and I totally could have used this the end of last year, but instead of a baby shower, having all your friends come over and grab a power tool and put the crib together.
Organized, with all the little bins. That is my secret hobby of getting super organized.
Oh, I love that about you. I am not. Well, I don't know. I like everything tidy because it helps my ADHD brain stay focused. But I want to be the home edit people where they have these perfectly organized. And every friend is sort of every friend has a different skill set. You could have that one friend who's really good at that stuff, and we don't have to go through this stuff alone. I feel like these trends are such an important reminder of that.
For sure.
So we've got an incredible episode for you guys today. First, in Her Story Unfiltered, Garrett opens up about her crazy, but rest assured, rare experience with her embryos being dropped during IVF. Then in Own Your Health, we're going to debunk the myth that birth control causes infertility. And our friend registered dietitian Anna Bohnengel will dive into how you can maintain a healthy weight while still enjoying the foods you love. And lastly, in Women's Health in the Wild, we're going to talk about the potential benefits of Ozempic for women with PCOS and the Ozempic babies craze. Excited to hear your take on that, Jenna. So let's dive right in. Her Story Unfiltered, raw, real, and rescripting women's health, one powerful story at a time.
Hi, my name's Garrett, and I am the founder of Cozy Cozy. I'm 33, about to be 34, and I'm based on the East Coast in southern New Hampshire. My IVF doctor allowed me to decide when I would trigger before my first ever egg retrieval. I knew I had so many follicles growing that I was, rich with eggs, so to speak. And she said, if you want to get even more, we could go 1 or 2 more days of, slight gonal F and the other Menopur I was taking. She goes, or if you feel all set with this, because I know you're feeling so sick, you could trigger now. And my intuition told me by day 9, I needed to trigger. And I am so glad I listened to my gut, although I am not a medical professional, because when they went in for my egg retrieval, they found fluid in my abdomen. I ended up getting hyperstimulated, and I ended up with 34 eggs and 20 embryos. Unfortunately, on the worst day of my swelling and hyperstimulation, the doctor called to tell me that 10 of my embryos had been dropped on the floor, which is just a fun, awful fact. That was sarcasm. My point in sharing this is I'm wondering why, like, what would have happened if I would have said, I want to get as many eggs as possible and continued to do stim shots for 2 more days? Like, what would have happened to my health? At the point where she let me make the call, my estrogen had already hit 4,000 and my fresh transfer had already been called off. So, would love some advice on what could have happened and maybe what to do next time. And then second question is, can OHSS, in your experience of egg retrieval, lead to poor quality embryos?
So much to unpack there. Oh my gosh. Wow.
I really feel the OHSS pain because both of my egg retrievals, I was on OHSS watch, and this past one that I did in January 2024, I had like a 7-day recovery. It was pretty rough.
Did you get any HCG trigger?
I did a small amount, yeah, because my doctor wanted to mimic exactly what we did the last cycle. And so she was like hesitant about it, but then she decided to do, I guess I had HCG and Lupron trigger.
Yeah. So I guess we'll just sort of start from the beginning and like unpack this a little. So OHSS stands for ovarian hyperstimulation syndrome. It is a serious complication of ovarian stimulation in IVF where the overstimulated ovaries, in response to an HCG trigger, no matter how much there is, or HCG from a pregnancy and a fresh transfer, cause accumulation of fluid in the abdominal cavity and can lead to significant bloating, discomfort, nausea, vomiting, dehydration, and in really severe cases, you can have fluid accumulation in the lungs and be at increased risk for blood clots. With modern IVF protocols, the risk of this happening is actually very low, like less than 1%. And the key to keeping this low is prevention. And the first step in that is really assessing your patient's risk prior to IVF. And so we consider young patients with PCOS or patients just with a high AMH level to be high responders. And you really just need to select your protocol accordingly. Lower dose medications, plan for a Lupron only trigger instead of an HCG trigger, because it's that HCG that really stimulates all those old follicles to be producing extra hormone, actually a hormone called VEGF, which makes your blood vessels pretty leaky and all the fluid can accumulate in your belly and you can get really, really uncomfortable and sick. So when you utilize a Lupron trigger, the chances of you having this is like essentially nil, like really, really low, because the Lupron trigger really shuts down hormonal signaling really quickly. Other things that you could do is take metformin during stimulation. That has been shown to decrease OHSS risk. And then converting to a freeze-all strategy. So meaning you get all the eggs, you mix them with the sperm in the lab, and when they become embryos, you just freeze everything and you don't do a fresh transfer.
I was so disappointed the first time around when I was told that I couldn't do a fresh transfer, because I had been waiting to do IVF for so long, and then I was just like, I wasn't educated enough at the time, but I like thought, oh, my transfer is going to be in a couple days, and they were like, yeah, no, that's not happening.
Yeah, well, not only is there like that risk of hyperstimulation when you've like been your ovaries are so large and you've gotten so many eggs and your hormone levels are so high, but also actually the window of implantation can be shifted in that scenario. And then the chances of pregnancy is actually a little bit lower. And so for multiple reasons, it's better to just do a frozen transfer, in those scenarios. But so freeze all, and then post-procedure cabergoline, which is a medication that helps decrease that VEGF hormone and sort of gets you back to a normal state faster.
Mm-hmm. What about the trigger shot question? Like, does the timing where she was able to decide, that seems pretty rare, right?
Yeah. So the highest risk of hyperstimulation is when the estradiol level is above 5,000, but you certainly can have it when it's lower than that. If I I can only assume that if she had hyperstimulation, that she got at least a little bit of HCG. And if she were to go any more days, like her estradiol level could have been double that. It could have been 8,000. At that point, I hope she would not have gotten any HCG. I've had patients with an estradiol level as high as 8,000, and they don't have hyperstim because they just got a Lupron trigger. You still can be uncomfortable because the ovaries are really big, but the hormones and the ovaries just get shut down really quickly when you use Lupron only. So, there are ways to adjust when you think someone is at risk, but one of the things that you can do also is just cut the stimulation a little bit short. 34 eggs, a ton of eggs. And so, I think it really, every patient's a little bit different. Every stimulation cycle looks a little bit different, but we have a lot of tools in our toolbox now to be able to decrease the risk significantly.
Yeah. And then that embryo dropping scenario was just,
oh my gosh,
icing on the cake. I feel like there's been a lot of, press around like embryo mix-ups recently, and it's horrifying. And I just want to say that like it's very rare, and you can attest to that
completely.
But, yeah,
I've never seen this happen. Listening to this, I had like a flashback to my fellowship. We had some session talking about ethics in IVF, and this was like an embryo dropping story was one of the simulated scenarios, and like what to do in that scenario of how to disclose that to the patient and what to do. And it just blows my mind that that's even possible. And I mean, these are humans that are taking care of your embryo, so of course there is room for human error. But if you like go into my lab, or probably most labs, and you see embryologists walking around with embryos in a dish, it's like 2 hands, really careful, walking at like measured pace. Like it is like unlikely, really unlikely that something like that would happen.
Yeah. Okay, that's good to know. Reassuring. Okay. Well, thank you, Garrett, for sharing your story, and
good luck in the future with your future cycles if you do more.
Yes, I'm glad they didn't drop all of your embryos.
I know.
I hope you had success.
Own your health. Ask us anything. Your questions and expert answers, because you are your own best advocate.
I've been talking a lot on Rescripted on our newsletter about just like so much misinformation when it comes to women's health. And one of the big ones, especially in the fertility world, is whether birth control causes infertility. And I think just in general, like the birth control misinformation. Can you address that one specifically?
Yeah, definitely. So I get this a lot. So birth control pills act by suppressing the ovaries and thereby preventing ovulation. And the low levels of hormones in these pills allow you to continue to get a period, but it's sort of an artificial period and not one that signifies a prior ovulation.
Mm-hmm.
Birth control pills are not only a great form of contraception, but they're actually the first line treatment for any menstrual cycle disturbances like irregular periods, painful or heavy periods, mood disturbances related to a period. So whether you went on the pill to treat one of these problems or you developed some sort of underlying condition at some point while you were on the pills, these pills are treating, or actually like masking the problem, but treating the problem so that you feel good and you feel like nothing's wrong until you come off the pill. And then when you come off the pill, the original symptoms you were trying to treat come back, or the problem that you were masking reveals itself. And it's that underlying issue that's the cause of the infertility and not anything the birth control did to you. Common scenarios that I see are like someone went on a birth control pills at a young age due to irregular periods. They come off the pills, they never get a period back, and it turns out they have PCOS. Or someone who went on birth control pills for contraception. They had a period of disordered eating, lost a lot of weight, developed hypothalamic amenorrhea, but they didn't know because they were getting a bleed from the birth control pill, come off the pill, try and get pregnant, they never get a period back. Or they went on birth control pills to treat really painful periods, and they stopped the pill to try and get pregnant, and the severe pain comes back, and it turns out they have endometriosis. So it's not the pill that causes these things. The pill is actually treating the problem. But it's not until you come off the pill and try to get pregnant do you actually have to address this underlying cause.
Yeah, no, I experienced that when I came off the pill. I didn't realize it at the time, but I had PCOS, didn't get my period back. I've talked about that a lot on the pod, but yeah, and then it's all of a sudden like when you actually want to try to have a baby,
It's like so
it
frustrating.
comes to the surface and it's really frustrating. But
And it's so easy to like blame the birth control pill because they've got to be related, right? But it was really the birth control pill was just treating this underlying issue.
absolutely. No, yeah. I feel like we'll continue to drive home that like we're fans of birth control for a lot of reasons, and always just remember to check your sources on the internet if you see posts that claim these sorts of things. Just make sure that it's science backed and that there's a medical professional kind of vetting it.
Yeah, for sure.
Another myth I wanted to quickly debunk is you can't get pregnant while you're breastfeeding. Can you speak to that a little bit?
Oh, sure. When you are breastfeeding, your prolactin levels are elevated, and prolactin works to suppress brain-ovary communication and therefore ovulation. But when you've been breastfeeding for a longer period of time, that's not like the brain-ovary communication is not always suppressed. And so you can have random ovulations or unpredictable ovulations and therefore like irregular periods while you're still breastfeeding and get pregnant. Or, if you're you can get pregnant the first time you ovulate before you even get a period while you're still breastfeeding, especially like if you're breastfeeding pretty continuously, like multiple times a day.
Yeah.
The suppression from the prolactin levels is more likely going to be stronger. But if you're starting to wean or like breastfeeding less than 3 times a day, then that signaling can start to come back and you ovulate and you can certainly get pregnant.
Yeah. And are there any limitations to like being on birth control while you're breastfeeding?
Not really. So birth control pills, if taken one, you don't want to take birth control pills while you're in like the 6 week postpartum period because of increased blood clotting risk in that postpartum period. But then after the 6-week period, some birth control pills can decrease your milk supply. But if you haven't had that issue, then there's no reason why you can't take it. It's not like going to pass to the baby.
Got it. Okay, cool. Because I feel like there's I have one friend who's like waiting till she's done breastfeeding before she goes on birth control. And I wasn't sure if there was any kind of rationale to that, or if it was just like a personal preference.
It just might decrease her milk supply, which can be really frustrating.
Oh yeah, for sure. I wasn't able to breastfeed.
Me either.
Yeah, no regrets, but in the moment it felt sad.
I hear you. You feel like really guilty, but a healthy baby is a fed baby, right?
Absolutely. So next, we're going to hear from our friend, registered dietitian, Anna Bohnengel. She's going to dive into how you can maintain a healthy weight while still enjoying food you love. I love this one because I'm Italian and I love food. Okay, let's hear from Anna.
As anyone who has struggled with their weight knows, the advice, eat less and exercise more, is totally bogus. Trying to eat less often just leads to binging, especially when we're feeling stressed. In the long run, undereating just slows down our metabolism, right? Meaning we have to keep eating less and less and less to maintain the same weight. Exercising more is equally unhelpful because A, exercise is just going to rev up your appetite, and B, because you need energy from food to be able to have a good workout. So rather than focusing on diets or restriction, a more sustainable approach is to focus on building a lifelong healthy metabolism and focus on nourishing yourself. A healthy metabolism comes not from being skinny, but instead from building muscle and consistently giving your body the nourishment it needs. So focus on filling your plate with the nutrition that's going to give you energy, that's going to make you feel satisfied, and is going to support muscle growth. So more specifically, this means filling your plate with protein from fish, chicken, meat, with tons of fresh fruits and vegetables, and high fiber carbohydrates like beans, lentils, potatoes, sweet potatoes, and winter squash. Now, this approach is not going to make you shed 30 pounds overnight, but it is going to free you from that yo-yo dieting and set you up for a lifelong, healthier relationship with food to support the healthiest weight for you.
Okay, I love that because I don't know, I just feel like diet culture, and we'll talk more about that in a later episode, but like diet culture taught us from such a young age to like eat less and exercise more. And again, bottom of the pyramid, just eating nutritious foods and
like changing your mindset instead of like restricting, adding in healthier things.
Yeah, adding to your plate instead of subtracting from it, for sure. Because, and actually I worked with a registered dietitian during my year off from IVF, and one of the things I realized during that time was that I wasn't eating enough. And like actually snacking more like helped kind of rev up my metabolism more. It was like I was kind of like starving myself, which is horrible to say out loud, but like I thought I was like trying to stay trim, but it was like actually killing my blood sugar balance, especially with PCOS, like insulin. And we'll talk about this in Women's Health in the Wild too, but like insulin sensitivity is such a big component with PCOS. So having those like regular meals that like with protein that like helped balance my blood sugar really helped my health overall.
I love hearing that. And I think that's a really good message to send out.
Women's Health in the Wild, must reads, must sees, and must tries for your wellness journey. So speaking of blood sugar balance, Ozempic, we've wrote a little bit about this on Rescripted, but you know, there's some emerging evidence suggesting that weight loss medications like Ozempic may improve fertility in women with PCOS by restoring hormone balance and regular ovulation, by aiding weight loss and enhancing insulin sensitivity. Can you speak to that as a fertility doctor? And like also, are people really kind of getting pregnant left and right with this like whole Ozempic babies craze? I haven't heard about it as much recently, but I feel like a couple months ago it was like
big in the news. Yeah, for sure. So this is really nothing new to us. So with PCOS, as we talked about, like the crux of the issue is insulin resistance. The high insulin levels are directly correlated with high androgen levels and, you know, the hair growth and the acne, and also directly related to the resistance of the ovary to respond to the brain signal, grow an egg and ovulate. And so when you treat the underlying problem, a lot of those correlated issues get better. You know, if you treat the insulin resistance, the high androgen levels can improve, and you might restore ovulation. And we've seen this in the PCOS population. So insulin resistance is also associated with increased weight and difficulty losing weight. And in the PCOS population, we've seen even prior to use of Ozempic that when you lose if you have PCOS and you're overweight and you lose 5 to 10% of your body weight, you can restore natural ovulation. So this is like something that we've known about for a while. And so, you know, enter Ozempic into the picture, which, you know, by the way, is not a new medication, but is just being used more and more now for weight loss. It's no surprise that this augmented weight loss can help restore ovulation. And so it's not that it's like a fertility drug, but just in these patients where weight loss can really fix the underlying problem. They start to ovulate. Pregnancy, of course, can happen.
Yeah.
Now, the thing to keep in mind is that in animal studies, Ozempic is linked with congenital anomalies. So right now, there is a recommendation for, a washout period, like a 2-month washout period between your last Ozempic injection to pregnancy.
Okay.
So for patients who are like planning an embryo transfer, we have them stop 2 months prior to the embryo transfer. Or if they're doing IVF, we actually just have them wait like the 2-week period because it can delay gastric emptying, and we want them to be safe going into an anesthesia-related procedure. But I think that this is a work in progress. Like we are getting more and more information about accidental pregnancies in patients who've been on Ozempic. And so far, there haven't been any increased rates of congenital anomalies. So is it considered a fertility treatment right now? No. But I think that the conversation is continuing to change. And I do work with some medical endocrinologists that commonly prescribe these medications, who are actually allowing some patients to stay on these medications while trying to conceive and then stop when they have a positive pregnancy test. And that really takes the right patient, the right doctor, have informed counseling and shared decision making to know that's like the right option for you.
Yeah. So I'm curious because I know a lot of fertility patients with PCOS that have been put on metformin. So like, is that because there's less of that risk, or like it's been more well studied?
Yeah, exactly. And there's no increased risk of congenital anomalies with use of metformin. And so that is a safe medication to continue to take even through your pregnancy. But because of these animal studies, I think it's going to be really, really hard to have like a randomized trial of Ozempic in pregnant patients. And so it's really just going to be observational studies where we're looking at patients who accidentally got pregnant, and then stopped the medication, and they've had some exposure to the medication, and what have their outcomes been. And so far, the outcomes have been looking really reassuring, like no increased rate of congenital anomalies. And so again, I think that there's more to come to this story.
Yeah.
But for the purpose of weight loss in PCOS, it can be really, really effective because this Ozempic is really treating the underlying issue with PCOS, which is insulin resistance.
Yeah, I always get confused by my own PCOS because I don't have insulin resistance. So I have like the elevated androgens and the polycystic ovaries, but I don't have the insulin resistance component. Obviously, maintaining blood sugar balance is important regardless. And I do take myo-inositol and D-chiroinositol. But yeah, I've always just been kind of confused because I always felt like I was doing the right things health-wise. And you do hear that like, oh, if you just lose a couple pounds with PCOS, like you might be able to restore healthy ovulation. But like my ovaries are very stubborn. I don't know.
Yeah, there are a couple of different flavors of PCOS, and you can have it without significant insulin resistance. And, everyone just needs to be, their treatment just needs to be tailored to them.
Yeah, absolutely. Well, awesome. So 2 months, so are the typical guidelines, like if you've been on a GLP-1, like Ozempic, you kind of come off of it for 2 months prior to any fertility treatments, or like same thing with trying to conceive naturally?
Yeah. So that's like the most common policy that I've heard across the country. And I think, my practice doesn't have a firm policy in place because we're not prescribing these medications, and we work really closely with medical endocrinologists. And I think that, if the patients are informed, that they can, make this decision for themselves. So we do have like very strict criteria, like a policy for like going into an egg retrieval sort of thing. So yeah, that is the general recommendation: 2 months of a pause, or, stopping 2 months prior trying to get pregnant, and then postpartum you can resume.
Awesome. Well, more to come on the Ozempic
for sure.
I'm sure. That's what's so exciting about this field.
For sure. Always something new.
Thanks for tuning in to From First Period to Last Period. If you enjoyed today's episode, be sure to hit subscribe so you don't miss any of our future conversations.
And don't forget to share this with your friends, because when it comes to women's health, we all deserve to be informed, empowered, and supported.
Still have questions? Email community@rescripted.com for a chance to have yours answered on a future episode. For more science-backed women's health content that meets you exactly where you are, head to rescripted.com or follow us on social @HelloRescripted.
We'll see you next time with more real stories and expert advice.